That's your mommy.
Yeah.
That's mommy when she was a baby. I did not find out about my intersex condition until I was about 17 years old. I think a lot of what I learned about my body being shameful, I learned from being in the doctor's office and the physician talking in sort of hushed tones with my parents and not including me in those conversations.
Your mommy's heart? Yeah.
My name is Katie Baratz-Dalke. I am a physician, a psychiatrist, and I'm also a mom. And I am an intersex woman as well. I have complete androgen insensitivity syndrome.
Intersex people are born with bodies that are biologically slightly different than what we would consider typically male or typically female.
When my parents found out what this diagnosis was, I think they were really worried that I would be rejected or bullied or harassed.
I met my first intersex patient during residency. She was a 17-year-old girl who I operated on to remove her gonads. And it was after the surgery that I fully realized that she probably had no idea what that surgery entailed.
Doctors today continue to do medically unnecessary cosmetic surgeries on these children to make their genitals look more typically male or typically female. These surgeries run the risk of lifelong consequences such as scarring, incontinence, loss of sexual sensation, psychological trauma, or permanent sterilization.
It is a human rights violation to perform a cosmetic genital surgery on a child who is too young to give consent when we know that those surgeries carry physical risks and psychological risks.
1, 2, 3.
I spent a lot of time growing up myself being afraid that I wouldn't find love and I wouldn't have a family.
There's a growing community of doctors who are realizing that intersex care is one of the greatest failures of modern medicine. And I think that it's a failure on a very systemic level. We can raise our children telling them there are different ways to be women or men or people, that there are different ways to be parents, and to not be ashamed of who they are.
I have a partner who really cares about me, and I have a wonderful daughter. When I was 16 or 17, I never would have imagined that I would be able to have the life that I do now, and I am so grateful that I do.
Medical evidence and medical ethics both point in one direction. It's time to put an end to medically unnecessary cosmetic surgeries on intersex children who are too young to consent. And medical professional associations should take the lead in making that happen.